Hey everyone, welcome back to Dr. Tripathy YouTube channel.
The thyroid is a small, butterfly-shaped gland in your neck. Don't let its size fool you. This little gland plays a big role. It produces hormones that control your metabolism. Metabolism is how your body uses energy. Think of your thyroid as your body's internal thermostat. It regulates temperature, energy levels, and even heart rate. When it's working properly, you feel energized and balanced. But when your thyroid is out of whack, it throws your whole system off kilter. This can lead to a range of symptoms that impact your daily life. Understanding how your thyroid works is the first step to taking charge of your health. Let's explore the common problems that can arise with this important gland. Thyroid disease occurs when your thyroid gland produces too much or too little thyroid hormone. This imbalance can wreak havoc on your body's systems. The two main types of thyroid disease are hypothyroidism and hyperthyroidism. Hypothyroidism, or underactive thyroid, is like having a thermostat stuck on low. Your metabolism slows down, leaving you feeling sluggish and fatigued. On the other hand, hyperthyroidism, or overactive thyroid, is like a thermostat stuck on high. Your metabolism goes into overdrive, leading to anxiety, rapid heartbeat, and weight loss. Both conditions require medical attention to manage symptoms and prevent long-term complications. Recognizing the signs early on is crucial for effective treatment. What causes these thyroid imbalances? It's often a combination of factors. Genetics plays a significant role. If your family has a history of thyroid disease, you're at increased risk. Women are also more likely to develop thyroid disorders than men. This is partly due to hormonal changes during pregnancy and menopause. Other factors that can contribute to thyroid problems include autoimmune diseases, certain medications, and iodine deficiency. Iodine is an essential mineral for thyroid hormone production. While some risk factors are beyond your control, adopting a healthy lifestyle can support thyroid health. This includes a balanced diet, regular exercise, and stress management techniques. Thyroid disorders often manifest in subtle ways, making them tricky to diagnose. Here are some common symptoms to watch out for. Hypothyroidism: unexplained weight gain, fatigue and low energy, dry skin and hair, sensitivity to cold, constipation. Hyperthyroidism: unexplained weight loss, rapid heartbeat, anxiety and irritability, tremors, difficulty sleeping. For example, imagine feeling constantly exhausted despite getting enough sleep, or noticing your hair thinning and your skin becoming dry and rough. These could be signs of an underactive thyroid. On the other hand, if you're experiencing heart palpitations, feeling jittery, or having trouble concentrating, an overactive thyroid might be the culprit. Section 5. Getting to the root of the problem, diagnosis and testing. If you suspect a thyroid issue, it's crucial to consult your doctor. Early diagnosis is key to managing symptoms and preventing complications. The diagnostic process typically begins with a physical exam and a review of your medical history. Your doctor will ask about your symptoms and any family history of thyroid disease. Blood tests are the cornerstone of thyroid diagnosis. These tests measure levels of thyroid hormones in your blood, helping to determine if your thyroid is overactive or underactive. In some cases, additional tests like thyroid scans or ultrasounds may be recommended to further evaluate the gland's structure and function. These imaging tests provide detailed pictures of your thyroid, allowing your doctor to identify any abnormalities. Section 6. Restoring balance. Treatment options for thyroid disorders. The good news is that thyroid disorders are highly treatable. The goal of treatment is to regulate your thyroid hormone levels and alleviate your symptoms. For hypothyroidism, the standard treatment is levothyroxine, a synthetic thyroid hormone taken orally. This medication replaces the hormone your thyroid isn't producing enough of, effectively restoring balance. Hyperthyroidism treatment options include anti-thyroid medications, radioactive iodine therapy, or surgery to remove all or part of the thyroid gland. Your doctor will recommend the best approach based on your individual needs and the severity of your condition. Lifestyle modifications such as a balanced diet rich in fruits, vegetables and lean protein, regular exercise and stress-reducing techniques like yoga or meditation can complement medical treatment and enhance overall well-being. Section 7. Living well with thyroid disease. Tips for a healthy lifestyle. Managing a thyroid disorder is an ongoing journey, But it doesn't have to rule your life. By adopting healthy habits, you can support your thyroid health and live a full and active life. Here are some tips for living well with thyroid disease. Prioritize a balanced diet. Focus on nutrient-rich foods including fruits, vegetables, whole grains, lean protein, and healthy fats. Limit processed foods, sugary drinks, and saturated and unhealthy fats. Stay active. Engage in regular physical activity such as brisk walking, swimming, or cycling for at least 30 minutes most days of the week. Manage stress. Practice stress-reducing techniques like deep breathing exercises, meditation, yoga, or spending time in nature. Chronic stress can negatively impact thyroid function. Get enough sleep. Aim for 7 to 9 hours of quality sleep per night. Adequate sleep is crucial for hormone balance and overall health. Section 8. Finding support and empowerment. Your journey to thyroid health. Navigating a thyroid disorder can be challenging, but you don't have to go it alone. Connecting with others who understand what you're going through can provide invaluable support and encouragement. Consider joining a support group or online forum where you can share experiences, ask questions, and learn from others living with thyroid disease. Talking to a therapist or counselor can also provide emotional support and coping strategies. Remember that knowledge is power. Educate yourself about your condition, treatment options, and lifestyle modifications that can help you feel your best. The more informed you are, the more empowered you'll feel to take charge of your health. Section 9. A beacon of hope. Early detection and management make all the difference. While a thyroid disorder diagnosis can feel overwhelming, it's important to remember that with proper management you can live a full and healthy life. Early detection and treatment are paramount. By paying attention to your body and seeking medical advice if you notice any unusual symptoms, you're taking a proactive step towards protecting your health. With the right medical care, lifestyle modifications, and support system, you can successfully manage your thyroid condition and thrive. Remember, you are not alone on this journey, and there is always hope for a brighter, healthier future.